Hi, I'm Dr. Michael Peluso, an assistant professor of medicine at UCSF. Today I'd like to answer some common questions about long COVID. What do we know about the underlying pathophysiology of long COVID? That's a really tough question to answer. Right now there's definitely more that is unknown than is known. There are some hypotheses about the different potential biological mechanisms that might drive long COVID, however. There are probably 4 or 5 different proposals for what might contribute to long COVID symptoms, but all of these are hypothetical and under investigation right now. These include things like persistence of SARS-CoV-2, the virus that causes COVID-19, where pieces of the virus might stick around in a person's body for longer than any of us anticipated. Things like immune activation or inflammation that might continue after somebody's had COVID-19. Issues with microvascular dysfunction or blood clotting that could happen on a microscopic level after somebody's had COVID-19. Reactivation of other viruses, things like Epstein-Barr virus, the virus that causes mono, might be important in contributing to long COVID. And one of the big questions we have is whether there is autoimmunity after a person's had COVID, whether the infection can kind of set off the immune system going haywire and affecting a person's own cells and own tissues. These are all under investigation right now, and there are a lot of people working really hard to figure this out. It's possible that there are multiple different mechanisms that might drive long COVID, and that certain types of long COVID symptoms might be caused by one or another mechanism. So I think right now there are more questions than answers, but I'm hoping that over the next year we'll begin to really better understand this. Who's most at risk for long COVID? Well, we know that there are certain risk factors for long COVID. We know that women are more affected than men. We know that people who are kind of in middle age, broadly defined, rather than the extremes of age, so very young versus very old people are at higher risk. We think that people who have other medical comorbidities, for example, things like diabetes, high blood pressure, obesity, might be at higher risk for long COVID. There's lots of data suggesting that people who are lower socioeconomic status or with less access to healthcare resources might be at higher risk for long COVID. And there are some suggestions that other chronic medical conditions like HIV might contribute to long COVID risk. So we're starting to figure this out now, but basically anybody who gets COVID is unfortunately at risk for long COVID, and we're trying to really understand why this happens to certain people and how to get people feeling better. Are there treatments for mild or moderate COVID effective in preventing or reducing long COVID symptoms? So in my opinion, outside of avoiding COVID altogether, the most important thing that a person can do to minimize their risk of developing long COVID is to make sure that they're up to date on their COVID vaccines. There's good data from multiple studies now suggesting that being vaccinated to protect against COVID decreases the likelihood that people will develop long COVID, even if they still get COVID. That doesn't mean that vaccines are 100% effective at eliminating long COVID, but they certainly help. There's a lot of question right now about whether treatment of acute COVID might decrease the risk of developing long COVID. And there's not clear data on that yet, but that's a topic that's really under investigation to figure out whether treating the acute infection decreases the likelihood of somebody having long COVID symptoms months later. Thanks for joining me today. Please subscribe to Exchange CME's YouTube channel and check back regularly for updates on COVID-19.